Good morning, everybody. Hello, and welcome to another in our series of the communication tapes, where we talk to people who are stakeholders and experts in the world of palliative care and who provide palliative care resources and education to our aged care workforce. I want to introduce you today to Kerrie Cunnigham, and I'd like to just first of all ask Kerrie for you to introduce yourself and just let us know where you work and what sort of work you do. Hello, Kerrie.
Sure. Hello, thank you, Sam. So, as Sam said, my name is Kerrie. I'm a palliative nurse educator with the PEPA iPEPA Victoria team. So, for those of you that may not know, PEPA iPEPA is a nationally funded program by the federal government that provides free education and observational clinical placements in the palliative care sector. And we do this free palliative focused workshops across Victoria as well. So, you may have seen advertisements for upcoming workshops in your local areas. So, thank you.
Yeah, and they are really excellent workshops. I always recommend to people when they're looking into the PEPA and iPEPA workshops to constantly be going onto your website, because every time I go there, a new location comes up. So if you're looking for something in your area, just keep checking in on it. So you've been working with PEPA and iPEPA for a long time, haven't you, Kerrie? And you've been in the
Yes,
palliative care world for quite some time too. Were you a
a
palliative care
few
nurse
years.
before?
Yeah, so I've worked in lots of different areas. So I've been in palliative care for over 25 years with a nursing background. And I've done a lot of different areas, but regardless of where I worked, I always had an underpinning in palliative care. So whether it be clinical work or project work or things along those lines. So even when I was working in management, it was always palliative care as well. So I did remote work up in the Kimberley for a while. I've done community based, I've done hospital, and I've got a background in oncology just for the fun of it as well. And I've done some pediatric palliative care too. So I know lots of little things, but I don't know everything. So I'm always learning. So it's really great.
So this is a really broad set
Yeah.
of experiences. I
Yeah.
bet you've come across a lot of communication, done well and not so well throughout your journey through palliative care. Are there any particular common challenges that you've seen in your lines of work that have been of note to you that you've noticed?
Yeah, I think one of the common themes that I often come across both when I was in a clinical space, but also in my role as part of the PEPA iPEPA team, is people feeling that they have a lack of confidence in what they're saying, or when they have to talk to family members or to patients or people who are unwell, but also other health practitioners as well, or the fear of saying something wrong to the people that they're caring for. So I often always tell people that communication is a skill that we need to continue to work on, like everything else. So it's one of those skills, just as like when we first started nursing, we thought, oh my goodness, I can never give an injection. Or when we first working in palliative care, how do we work out a syringe driver? Or even when we first learnt to drive a car, for those people that remember the 3 pedals, there used to be 3, not just 2. We need to practice and keep practicing it throughout our life. And then as we get better at it and as we continue to keep practicing it, it enhances our communication and our interactions with the people we're caring for.
Yeah, no, that's really well said. I think sometimes because communication is so in line with just talking, which is something that we all do, we
Yeah,
think it's something we should naturally be really good at. But
yeah.
having conversations, therapeutic conversations, and especially around death and dying and values and wishes, it's a skill, like you say.
Yeah, absolutely. Yes.
Um, Now, we ask this question to everybody, Kerrie, but it's sometimes tempting to think that experts in the field have never made mistakes when it comes to communication. And we all know that that actually isn't the case. Can you think of any significant lessons that you've learned in the past, and anything you want to share with us?
Yeah, sure. So thankfully you gave me these questions beforehand, so I had time to think about it. So it was really helpful. So I think one of the ones that's always really stuck with me was once I was working with a family and I became upset as we were talking about the person's impending death, because for some reason it just triggered something in me that it was like, oh, this could be my family, this could be what we could go through down the track. And so I apologized to the family, and the patient's wife took my hand, looked me in the eyes, and said, "You're allowed to have emotions. You're human too." And then she actually gave me a hug and said, "Thank you so much for showing me you care about my husband." And I just had to take a moment and, pull myself together and say thank you, and it was fine. In the back of my head, I was thinking, oh my God, I'm going to lose my job. I'm so unprofessional. But she actually reminded me, that we're allowed to be human. So we do this job because we love to help people, that we have that empathy, we have that sympathy, we have that compassion. But we can't lose those things whilst we're doing that care. So it's important to remember that we do make mistakes because we're human, and it's okay. It's okay to say sometimes, oh, I'm so sorry, that came out the wrong way. That's not what I intended. Or I can see that what we're talking about can be upsetting to you, or is making you sad, or is distressing you. Are you okay? Would you like to stop? So I think those things that make us really good at our jobs also make it okay for us to stop and say that, oh, I made a mistake. It's okay. Because we are human and we've got that. So it's important to remember to always speak from your heart, because your heart will always guide you. Even though you're doing a professional job and you stay in that professional space, it's allowed to actually help guide where we are. And then also, if we allow ourselves to be a little bit vulnerable when we're talking about these really tricky scenarios about that your person is going to die. It mightn't be today, it mightn't be tomorrow, but this is a palliative journey. And when we get to the end in the terminal phase, well, yes, they are dying. That's putting ourselves in a vulnerable space. So if we do that, when we're asking the people that we're caring for to be in that space, we're allowing trust to build and that rapport to build. And so they'll always be there with you. So not everybody is happy when their loved one is dying, don't get me wrong. But at the same time, by us showing that we are human and we make mistakes, it's okay. Doesn't mean we don't run out of the room and then later on berate ourselves about it. But it's about learning and saying, no, that's okay, that's fine. And if you stop that compassion and you stop having that empathy in those moments of, oh my goodness, did I do that right or wrong? That's when you're heading to burnout. So you need to do something about it. So you need to look at your own self-care, or look at what you're doing, how you can support yourself so you can continue to support the people you're caring for.
That's beautifully said. Thanks so much, Kerrie. I like that you've brought together that sort of the compassionate practice when you're in the room and presence with the person, the
Yeah.
humanity that you're bringing into the conversation, but also that gentle reflection, and that it's okay to come out of a conversation and be like, oh no, that went quite well, or gosh, that didn't go quite as well as I wanted it to, and like
Yes.
just really gently reflect on that as a human being, knowing that you're two humans interacting with each other over something that's a really big and emotive conversation.
Yeah, absolutely.
Yeah, it's normal to be navigating really big emotions when we're talking with people about the loss of loved ones or their own losses and functional decline and what that means to them. It,
Yeah,
brings up a lot of emotions, doesn't it? So, no, I think that's
absolutely.
a really good lesson. Thank you. Have you got any tried and true tools, Kerrie, that you carry with you or share with regards to communicating, especially with patients and clients, but even maybe also colleagues as well?
Yep. So it's not my tool, it's not my trick. I've stolen it. So I stole it, and I'm very proud to say that I've stolen it, but from Dr. Jo Doran, who's a palliative care physician from Queensland. So for those people that attended the summit last year in the Hume, she spoke and she was fabulous, but she's done quite a few things. So what I've done is I find things that work for me over my lifetime, and then I use things that work and I put aside other things. So it's like putting things in my backpack that I need and then taking them out when I don't need them anymore. So from her, and also Catherine Mannix, which is a palliative care physician from the UK. So between the two of them, the main one that I use or I think about or reflect upon is if we approach a conversation with somebody, it doesn't matter who it is, if it's the person who is unwell, the family member, a carer, colleagues, team members, external providers, but if we approach that conversation with open, non-judgmental and compassionate curiosity, we always allow the person that we're speaking with a safe space to talk about what their greatest fears or concerns are. Because the thing to remember is sometimes our colleagues have never been in this situation before. They might be brand new to the environment where they are. So this is scary for them. They might have come from a background where we don't talk about it, or this is not something that is new to them, or they're just brand new to aged care. And unfortunately, in the aged care sector, people's length of stay is now about 16 months from admission to deterioration and death, which is very new for a lot of people coming into aged care sector. So we need to be mindful of that. Another tip that we talk about in our communication workshops is to remember that we need to put our own agenda to the side and allow the person that we're speaking with to lead the conversation. And our role is to support them in the journey. And sometimes things that are really important to us as healthcare providers, okay, so we need to give you your medication. Okay, we need to talk about discharge planning. We need to talk about this. They couldn't care less. They want to talk about something else that's got absolutely nothing to do with that. And we need to allow them the space to do that at times. So whenever we talk about when we do our communication workshops, so we have a compassionate communication workshop with the iPEPA PEPA team. One of the big things that we talk about is putting our agenda to the side and allowing us to be in that space, that attentive listening space, where we can just allow the person to actually guide us where we need to be, and then we can follow that conversation.
I like it. I think Jo Doran called it being a Labrador, didn't she?
Yes, she did. And I've stolen that. When we do our training, I have a photo of a Labrador up there, and I have told Jo that I've stolen it. So Jo, if you're listening and you want to see it, that's fine. I can send you a copy of the presentation. That's okay. So yeah.
I love it. I think if Jo knew that everybody was sharing the Be a Labrador philosophy, she would be happy to know that this beautiful way of communicating is being spread far and wide.
Yes, absolutely. Yeah.
I love it. And I have one last question for you, Kerrie. If there's one thing that you just wish people knew about communication, like one take-home message that you could give, what would it be?
So I think old sayings are the best sayings sometimes. So there's the old saying that says silence is golden, and it is very, very true. So allow for silence and sit with it. I know it's not something that we do naturally in healthcare, especially from a nursing background. We always want to fix something, and we're always so super busy with everything and all of our competing things that we're trying to get done in a day. But allow for silence and just be with it. So as part of the workshops, I have a slide that says silence has the same letters as listen. And I found that when I was doing some research into communication, and I had to stop for a second and thought, oh my goodness, it does too. So if we stop and sit in silence and we listen to what is being said, or in some cases what is not being said by the people that we're with, that's when we find that we can get the best connections and the best outcomes for those people, because we're allowing them to lead us in a direction that is important for them. That can be their greatest fears or their greatest worries, or just, I don't know what's going to happen next week. I don't know what's going to be said. I'm a little bit whatever the next part of that sentence is. But if we stop and interrupt them, we never get to that next part, which I think is a really important thing. And I get that it's really tricky because we've all got competing things for our time, for our energy, but sometimes taking that extra minute to sit in silence with the person just is the best outcomes that you can get.
I think that's an excellent take-home message to end on, Kerrie. The power of silence, the tool that is silence, cannot be underestimated. Thank you so much for chatting with me today. We will be adding lots of links to PEPA and iPEPA in the show notes to this interview. So if you want to get in touch with Kerrie and her team, or see what's going on in your local area, just go in and have a little look, or contact me and Rose if you're not sure. And yeah, it's been a pleasure chatting with you today. Thanks so much.
Thanks so much. Have a good day.
Thank you.